What is dental fluorosis and what causes it?
Dental fluorosis is simply the malformation of dental enamel. And actually, dental fluorosis has affected not only the enamel but also the dentin. The dentin is the inside layer of the tooth. The surface layer is the enamel, and that's what we see. We see white spots on kids' teeth, and that's what we call dental fluorosis. The way it forms, basically, is that the fluoride interferes with the development of the tooth. I did 10 years worth of research in my laboratory studying tooth development, so I know how teeth develop. And Pamden Beston and a few others have been looking at the effects of fluoride on tooth development. And we now believe that there are several mechanisms involved. Fluoride could be inhibiting the enzymes, the serine proteinases that are degrading the final traces of proteins that are left behind in the teeth. The proteins, if they're left behind on the surface of the enamel, will take up space, and it won't allow the crystals to grow to this beautiful, shiny luster that you see normal enamel presents itself. You see these white spots or splotches or lines. In more severe fluorosis, you actually see the surface layer flaking off. You see brown spots. The classical Colorado brown stain, we're now seeing that in North America in fluorosis area, in areas of fluoridated cities where kids are adding to the fluoride exposure with toothpaste. We're actually getting brown stain, the Colorado brown stain, in healthy kids. Now, it may not be a big concern to them, but the current concern I have, obviously, is that they've got too much fluoride in their system anyway.
Well, that's actually my next question, because certainly in America, the various government agencies now dismiss dental fluorosis as a cosmetic effect, that it's, polish it off or do something with it, and it hasn't done any harm to the person. Could you address that question? Is it just a cosmetic effect? Should we be concerned about dental fluorosis for other reasons?
Well, number one, simply a cosmetic effect is a brush off. What basically they're saying is that we're willing to accept a certain amount of cosmetic problems to prevent decay. Well, if the fluoridation isn't preventing decay anymore, and there's now plenty of evidence in the last 5 years that it's not preventing decay anymore, then the fluorosis that's being produced is now being treated for many different, in many different ways. It's being treated by surface polishing, by bleaching, by porcelain veneers. If you actually estimate how much work is being done on kids with dental fluorosis, we're treating way more teeth for the problem of dental fluorosis than we would treat if there was a marginal increase in dental decay from taking fluoride out of the water. Most of the studies now show that the fluoridated cities have twice the incidence of dental fluorosis, and yet the decay rate is no different. Number two is that the fluoride is accumulating in these people, and I've got lots of evidence to show you that even if you stop the fluoride exposure at a very early age, the kids still get fluorosis in their back teeth because the bone is loaded with fluoride. Their system develops or picks up so much fluoride from the overexposure from the water and the toothpaste and other sources from the diet that the bone has too much fluoride. The bone is the source of the fluoride that causes the dental fluorosis. Now, because they have so much fluoride in the bone, we have more concerns about tooth development, delayed tooth eruption, malocclusion, possible bone fracture, premature skeletal development or maturation. There are many concerns now that are appearing from research that fluoride in kids in their bone system is not good. Add to that the risk for osteosarcoma.
Explain what osteosarcoma is.
Bone cancer. Now, I have a serious concern about bone cancer. We're starting to see some publications now that links fluoridated cities with bone cancer. There may be a number of explanations for this. We now know that fluoride reduces testosterone. there may be a connection between this lowering of testosterone and osteosarcoma in young males. I have a concern because nobody has yet measured the amount of fluoride that the bone cells are exposed to when they're turning bone over. If kids have higher fluoride levels in their bone, and their bone cells are exposed to those higher fluoride levels, we know from in vitro studies in test tubes and in culture, that fluoride at higher concentrations are cytotoxic, that they cause damage, they can cause cancer, they can cause, these higher levels can cause all kinds of damage to the cell. So these bone cells are being exposed to, likely, higher levels than normal. And nobody has yet measured right locally, right next to the cell, how much fluoride these cells are being exposed to.
Tell us about your study where you looked at the levels of fluoride in the bones of Montreal people and the bones of people in Toronto. Explain where this study came from and what you found.
I got interested in the fluoride accumulation in bone, and that's one of the reasons I was concerned about water fluoridation. When I discovered that you didn't need to swallow fluoride to make it work to prevent dental decay, I was concerned that people were accumulating fluoride in bone, in kids and elderly patients. At the time that all of these epidemiological studies were being published, where there's an increased risk for hip fractures. Danielson studies, Jacobs studies, these were studies that were starting to raise some concern in the medical community that perhaps fluoride could be causing some harm, some increased risk for bone fracture. So we set out to actually prove that 1 part per million wasn't really that detrimental, that it wasn't affecting the bones the way that some of these studies were suggesting. And that's how we actually got funded. We set out to prove that it was safe. Whether or not that's why we got funded, I mean, that's irrelevant. But the way we designed the experiment was simply to collect hip bones from people that were donating their hips during total hip implant surgery, compare the bone samples that we retrieved from people in Montreal, where Montreal is not fluoridated, never has been fluoridated. Compare that to the Torontonians, Mount Sinai Hospital. We now have compared about 60 samples. It turns out that the Montreal bone samples have a very small variation in terms of their fluoride content and hover around 200 parts per million. The variation in the Torontonian hip samples is tremendous. It varies from 200 up to 2,500 parts per million. We're now looking at just looking at one disease entity, osteoarthritis, factoring in all of the age effects, etc., and not even looking at Toronto versus Montreal, just simply looking at the fluoride content. Now we have done that. What we have done now is to look at the fluoride content in the same type of bone, and we've discovered actually, or Debbie, who is the PhD student, Debbie Chashra, has discovered that there's a direct correlation between the fluoride content and the architecture of the bone. In other words, fluoride just from water fluoridation exposure, because we presume that the Montrealers and Torontonians have had the same amount of toothpaste exposure. Because in Canada, fluoridated toothpaste was introduced at the same time. We now believe that the little bit of fluoride that's been incorporated into their bone has affected their architecture. Now, whether that's positive or negative, we haven't got enough data yet to show. And the abstracts that we've published so far at the international meetings basically report these findings, that there are differences between Toronto and Montreal, that we are seeing effect of fluoridated water on the architecture of the bone. Whether or not this makes the bone slightly stronger or slightly weaker, we don't know yet. We do know from animal studies that the strength of the bone actually starts to decline the more fluoride you have in the bone. The fluoride makes the bone more brittle because the crystals are packed tighter, and these crystals actually make the bone like a crystal, like a more easily fractured crystal, and therefore a bone that's rich in fluorapatite or fluoride will break more easily. It's more brittle.